So next speaker is Sudeep Naidu. Sudeep Naidu, Ergonomics of New Age Surgery, Laparoscopic and Robotic.
I would also like to add cerebral and miral surgeon and GI transplant surgeon at R&R Hospital.
Initially, thank you to the organizers for giving me this opportunity. When I suggested this topic to Dr. Bhalla, I thought it would be a controversy between robotic and laparoscopic surgery. But the year 2017 is the tipping point when it is conclusively proven that robotic surgery is superior to most aspects of laparoscopic. I say most, not all. So what is the ergonomic risk between robotic and laparoscopic surgery? Work-related musculoskeletal injuries are a very common phenomena in this new age surgery. Various studies have been done to assess discomfort, fatigue, muscle activity and the position of both you and the patient. And how are these assessments been done? They've been done with questionnaires given to surgeons asking for post-operative pain, discomfort, fatigue. Biomechanical load on the hands and shoulders has been measured, and motion tracking sensors and EMG are also being used, electromyography. I will come to that later. So what were the results? This study from 22 November very clearly shows that in robotic surgery, there is increased back stiffness due to the posture and due to the static neck position. The neck does not move as much as in laparoscopic surgery. There is increased pain and discomfort. Whereas in laparoscopic surgery, we are all aware, most of the world being right-handed surgeons, there is right finger numbness, right shoulder stiffness, and surgeon irritability associated with these musculoskeletal phenomena. The odds ratio for right shoulder pain was 0.8, but it was not significant, whereas left shoulder pain, I suppose this is a reflection of less left-handed surgeons in the world, but having more discomfort, and the fact that most surgical instruments are designed for right-handers. So it was very significant. The right deltoid and the trapezius showed excessive muscular activity, significantly higher. So what were the recommendations? Surgeons have to be given awareness about their operating posture. Targeted physical and occupational therapy interventions should be done to make yourself as comfortable as possible. And work-related musculoskeletal disorders should be decreased so that your life as a surgeon has a longer tenure. So these are the 2024, I think, guidelines which came out in the American Journal of Surgery, and they compared all the surgeons, the open position, the robotic, the laparoscopic, and the overall operating position. This article is a must-read for all young surgeons. It details exactly how, and I think Dr. Balchandra has already given you the basics in his talk, and this expands further with diagrams telling you exactly how to adopt what posture during which surgery. It is not that laparoscopic surgeons do only laparoscopy. I think any good surgeon should be able to do all three: laparoscopic, robotic, and open surgery. So this is the PRISMA, the reporting of systematic reviews and meta-analysis of true robotic surgery ergonomics. There were 29 articles which were compared with 3,074 participants. The robotic surgery showed superior ergonomic benefits and reduced workload for both surgeons and trainee surgeons. And compared to other procedures, for some reason, gynecological procedures, probably because of operating on the pelvis, the fact that there were more lady gynecologists, it showed greater surgeon-reported strain. And the other odd thing which came up was, apart from gynecologic surgery, ladies had a higher incidence of musculoskeletal injury. And what I feel is, again, in a male-dominated world, all our instruments are designed for men. The size of the handles, the length of the scopes, everything. And they also found out in their statistical analysis that if you wear less than 6.5 glove size, you are more prone to musculoskeletal injuries during laparoscopic and robotic surgery. So how do we find out whether one is prone? Today we have a lot of intelligent tools at our disposal. Virtual reality, augmented reality, artificial intelligence, machine learning. We are going to be increasingly reading these terms, using them in fact. Today you have a facility for augmented strength. The instrument can sense the resistance, and if you are not applying enough strength to cut the tissue or handle the tissue, the instrument can be augmented. We have reached that level. Haptic manipulation. The instrument can sense the resistance of the tissue, the grittiness, which as open surgeons you all know that you have to feel the tissue sometimes. And that tactile sensation is lost in laparoscopic and robotic. But the instruments are reaching there. The machines are learning. Stress and fatigue detection. The machine can sense that the surgeon is getting tired. Tomorrow you will get a warning, some flashing red light or something in the corner telling you that, listen, you need to take a break. And posture-related deterioration can also be sensed. So this allows us to optimize surgical performance and also improve our surgical training. So what are these wearable sensors? They can track body motion techniques, the force and torque analysis, the myographic activity, and the level of stress in the surgeon using ECG electrodes and numbness using electrodermal activity. All these can be tracked today. This is an interesting study in which they compared 3 established robotic surgeons versus 3 fairly experienced laparoscopic surgeons who had not done robotics. And it shows that comparison of fatigue and recovery time used in both. And in both, the robotic surgeons came out ahead. So experienced laparoscopic surgeons shifting to robotic should be the norm now. And how do you appraise all these ergonomic activities which I have mentioned, the fatigue, the muscle, the movement, everything? By using these sensors. You have a device which records everything in one place. You got sensors placed all over the body. The surgeon operates, and the data is collected with the bottom right chart, as you can see. A whole lot of myographic activity, fatigue, stress relationships are drawn up. And what does this help? Just as you create an avatar today in WhatsApp, this is each individual surgeon's holographic avatar. So the machine can assess where exactly you're going wrong. And today, if you're a trainee surgeon, you operate and compare yourself with this activity, and you find out where you're lacking. Is there any paper on Indian surgeons? Yes. The World Hospital over here has done a study, and this paper is a multicentric paper from Jabalpur, Ranchi, and the University of Iowa. Rates of musculoskeletal injuries were higher among surgical trainees in India. There is limited awareness in India on surgical ergonomics, and teaching has had a positive impact in reducing injuries. What can you do to remedy this? A surgeon should do resistance training, use rubber bands and weights. Forearm compression sleeves can be worn. Stretching exercises. Massage may help reduce forearm fatigue. Micro breaks with targeted stretching. Active ergonomic training and improved use of armrests. Somehow we are loath to use armrests which should actually be used. And like I already mentioned, every individual's hand differs, so you need hand controller designs. What is the future? All this data all this data which is collected from surgery can give you insights. Okay, certain patterns can be drawn up. Those of you who play golf know that it is all about muscle memory. And laparoscopic and robotic surgery is just akin to golf. You are using your muscle memory to operate. So allocating resources, you can choose the best surgeon, the most experienced surgeon for a particular difficult task. And it can also influence the design of your instruments. So in the future, we hope that the training of surgeons, it is possible to simulate conditions, make it more difficult during training so that it is easier and safer for our patients in future. Thank you.
Thank you, sir, for your excellent talk. By prioritizing ergonomic design in laparoscopic and robotic surgery, we can create an efficient surgical environment, ultimately leading to better patient outcome. Thank you.
Thank you.